I heard some defense and some fear of the pharmaceutical companies' ability to earn sufficient profits to continue research and getting needed drugs to market. Members might remember the situation that I described when we were debating the insulin bill before we went out into this hiatus before we passed the bill a few weeks ago. And that's the case of Gilead and the pharmaceutical drug PrEP, which they didn't actually do the research for. They offloaded that. They actually resisted it, but in many cases, pharmaceutical companies simply allow other entities, public entities, universities and the like, to do research for them, and then take that in and market that drug under that use or that newly construed use. That's exactly what happened with PrEP, one of the drugs that was part of the combination drug therapies to suppress HIV in an individual. And the theory was that maybe one could be used on a prophylactic basis and not allow HIV infection. It was proven to be 100% effective. Gilead then went and started manufacturing and selling that drug for that purpose. It cost Gilead $60 a year to manufacture that drug. They charged $20,000 a year for a prescription. Members, please think about that for a minute. They did none of the research. The taxpayers supported that research. They manufacture the drug. It costs them $60 a year to manufacture, and they charge $20,000 a year. As a matter of fact, that price, even though it's available to some people through their health care benefits, to many it's not, because of course we have these fake health care plans parading as high deductible plans. Those are non-health care plans. And we have a lot of people who simply don't have health care. And so they're excluded. So in fact, we live in an era when we could bring new transmissions of HIV in our country down to 0 if people get effective access to treatment once they're affected or can prevent being infected in the first place. And yet we've plateaued, and we see in Minnesota alone just 300 new infections per year, and we've been turning in those results for 10 years. That is at the feet of the pharmaceutical companies that are making profits that are beyond anything that we can possibly imagine. There will be no danger of the pharmaceutical companies not continuing to make very, very handsome profits if we're able to somehow, some way, get a handle on these unconscionable prices. And if we also begin to build in policies that get at the drivers of those prices, like the pharmacy benefit managers that benefit from that delta, that differential. And rebates. Why do we even have rebates? Because of the unconscionable prices that the pharmaceutical companies are charging. So members, I'm glad we're we're at the threshold of a discussion. That's what this bill feels like. But please, we are absolutely seeing people's lives and health and ability to thrive undermined and even worse by an industry that has no conscience, that puts outrageous profits at the forefront. These are not companies that exist for the public's benefit or the public's interest. That is our job, members, and let's get back to that work. Thank you, Mr. President.